Muscles of mastication. Muscles of mastication. What is mastication? Mastication is nothing but chewing. Is it clear? Mastication is chewing. Muscles of mastication, they are mainly four in number. Okay, two on either side. Muscles of mastication. Two on either side. So what are they? Muscles of mastication. They are. Where you can see that one? You can see that one on page number 238. 238. So there are four. Temporalis, masseter, mesial pterygoid or medial pterygoid, lateral pterygoid. Are you with me? So mesial pterygoid, lateral pterygoid, temporalis, and masseter. Every muscle starts somewhere and ends somewhere else. Mostly the starting and ending will be in between two bones or two joints. It helps in bringing some movements. Is it clear? So the place from where it starts is called point of origin, and the place where it ends is called point of insertion. Point of origin and point of insertion. What is that? Point of origin and point of insertion. So likewise, for temporalis, masseter, medial pterygoid and lateral pterygoid, they all got point of origin and point of insertion. Is it clear? Well, temporalis and masseter, they are present on the outside of the mandible, outer surface of the mandible, whereas medial pterygoid and lateral pterygoid are present on the inner surface of the mandible. What I mean to say here is temporalis and masseter on the outside, okay, whereas medial pterygoid and lateral pterygoid you can see on the inside. Means two muscles on the outside, two muscles on the inside. Let's talk about point of origin and point of insertion of temporalis. Temporalis, the name itself is suggested. Temporalis, from where? Temporal.
Yeah.
Exactly, yeah. Temporal. So it starts from the temporal bone. That's the point of origin. Are you with me? Temporalis. And where it ends, point of insertion? Point of insertion will be this, the coronoid process of the mandible. Coronoid process of the mandible. The point of origin is from temporal bone and point of insertion is at coronoid process. Means like this, as you can see. So it goes inside like that and attaches there. Is it clear? It goes inside and attaches there. Okay? I'll talk about functions in a while. I'm not worried about functions at the minute. I'm just talking about point of origin and point of insertion. That's about temporalis. What about masseter? Guys, this is the cheekbone. Cheekbone, what you can see. This is the cheekbone, otherwise called zygomatic bone. Okay, so masseter muscle, point of origin is the lower border of the cheekbone, of the lower border of the zygomatic bone or zygomatic arch. This is the arch-like thing, isn't it? If you see from inside, it's like an arch. It's like an arch. Lower border of the zygomatic arch, and all the way to the outer surface of the angle of the mandible, as you can see there. Is it clear? From here to here, like this. Yes? So from lower border of the zygomatic arch to on the outer surface of the angle of the mandible. Is it clear? Angle of the mandible. That's about masseter. In case of, so there are two muscles present outside, isn't it now? Now we are moving on to the muscles which are present
Inside.
on the inside. Guys, if you see, this is the palate, right? This is the mouth. Just behind the one, you can see two bones there. Okay? This is the medial pterygoid and that is the lateral pterygoid. This is the medial pterygoid and that's the lateral pterygoid. So the name itself is suggested, isn't it? So medial pterygoid muscle from point of origin is medial pterygoid plate. Are you with me? Whereas the lateral pterygoid muscle from the lateral pterygoid plate. Are you with me? Now it's about point of insertions for both muscles. So for example, for medial pterygoid muscle, the point of insertion could be on the inside of the ramus of the angle of the mandible here. So for masseter, it is outside. For medial pterygoid, so here. So from here all the way it goes there. From medial pterygoid plate to the ramus of the mandible there. Is that clear? Inside. Whereas for lateral pterygoid, the lateral pterygoid plate is the origin, whereas point of insertion could be, what is this?
Condyle.
Condyle. Is that clear? So one goes to the ramus of the mandible there, one goes to the condyle. It's a beautiful arrangement of muscle, isn't it? All the times. So as you can see here, outside, for example, temporalis, from temporal bone to the coronoid process. Masseter, from lower border of the zygomatic arch to the angle of the mandible on the outside. Medial pterygoid, from medial pterygoid plate to the ramus of the mandible. And again, the lateral pterygoid plate from lateral pterygoid muscle from lateral pterygoid plate to the condylar head. Okay, are you with me? So that's about point of origins and point of insertions of muscles of mastication. About the functions, all the muscles, they help in closing the mandible, and only lateral pterygoid muscle, it helps in bringing side to side movements. Is that clear? All muscles help in closing. Lateral pterygoid muscle helps in bringing side to side movements, and the temporalis muscle helps in bringing forward movement. Any doubts? That's about muscles of mastication. So they might give you option as well, buccinator. They might give you 5 options. Okay, and they might ask you which one of the following is not a muscle of mastication. It's a buccinator. It's a muscle of cheek. And they ask the questions like, what is the function of lateral pterygoid? It helps in bringing side to side movements. What's the function of temporalis? It helps in closing as well as forward movement of the mandible. Is that clear? So I don't think we can expect any complicated than this one anyway.
Stop.